watching Health and Wellness, Save a Life. I'm Gargi Rawat. Today we're talking about sudden cardiac death. And the problem of sudden cardiac death is a major concern all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to the sudden change in lifestyle and food choices. And when medical emergencies like cardiac arrest take place around a person, it's important to be prepared. If you're aware and informed, then you can take steps to revive a person and save a life. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation. It is even more important to learn about CPR if you have a loved one who has a history of cardiac disease. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest. And today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Kaushal Kumar Harlalka, interventional cardiologist, Goyal Hospital and Research Center, Goyal Heart Center, Jodhpur, and Dr. Nikhil Motiramani, interventional cardiologist, Motiramani Heart Clinic in Raipur. Thank you so much, doctors, for joining us on the program and creating awareness about this issue. Dr. Harlalka, I'd like to start with you. And can heart failure cause sudden cardiac arrest?
Yeah, definitely. First, I would like to tell what is heart failure. Heart failure is a condition where his heart is not able to give proper blood supply to other vital organs. So it is of majorly two types. First type, heart pumping system is damaged. In second type, heart is not able to relax properly. So when heart pumping is damaged, so sometimes there are sudden increase in the heart rate. Heart rate becomes suddenly 300, more than 350. That is labeled as ventricular tachycardia, ventricular fibrillation. So this ventricular tachycardia or fibrillation is one of the important cause for the cardiac arrest. So we can say heart failure is one of the important cause of cardiac arrest.
All right, Dr. Motiramani, if you could tell us, a competitive lifestyle keeps this generation under constant stress. Can constant stress cause sudden cardiac death?
Good afternoon, everyone. That's basically, I think, what our era is dealing with, the stress phenomena. So what stress does is actually, it causes adrenergic drive, what we usually say as fight or flight reactions. So this release of hormones, what they cause is constriction of the arteries, which in layman term, I would say that it causes the shrinkage of the arteries. And because of that shrinkage of the arteries, the blood supply of the heart may get affected, leading to sudden cardiac deaths. Also, there can be genetic disorders like long QT syndromes, which with this sudden excessive adrenergic drive during stress or response may cause the heart to stop suddenly. So yes, it leads to sudden cardiac arrest for sure.
All right. Now, Dr. Harlalka, what are some of the emergency actions for helping someone experiencing a heart attack and cardiac arrest?
Yeah, this is very particularly very practical question. Basically, there are two entities. One is the heart attack and second is the cardiac arrest. So heart attack is one important cause of cardiac arrest. So how come one person can know that he or she is suffering from the heart attack? So most important, that symptom is the chest pain. That is retrosternal chest pain. We say it is anginal chest pain. It is very severe in the nature. It is sometimes heaviness, constrictive or stabbing type of. It may radiate up to lower jaw, both of the shoulders, interscapula, up to navel part also. And this chest pain is associated with palpitation, sweating, ghabrat, and sometimes there is blackout of the vision. So whenever person is suffering with this type of chest pain, if they are having some aspirin or Disprin tablet at home, immediately they should take one chewable Disprin. And if sorbitrate tablet is available, they can put it below the tongue. And after that, they should go the nearest medical helpline they are having to get one ECG done, and they should consult a physician or cardiologist to confirm the diagnosis of the heart attack. Because major heart attacks are usually detected in the ECGs that is easily available. And sometimes if minor attacks are there, we took help of echocardiography or other blood investigation to confirm the diagnosis. And second part is the cardiac arrest. Definitely, cardiac arrest, as you mentioned earlier, cardiopulmonary resuscitation. This is the lifeline for cardiac arrest patients. So, if patient suffers from cardiac arrest or nearby any passerby or attendant give the cardiopulmonary resuscitation, that is the emergency action and life saving for that person.
Dr. Mojaramani, if you could tell us, if not treated immediately, sudden cardiac arrest can lead to death. When a sudden cardiac arrest occurs, how can CPR then help? If you could explain for our viewers, and what are the correct steps of CPR?
Absolutely. This is, I think, the need of the hour that most of our public actually learns that what actually sudden cardiac arrest means and how it is different from attack. So when we are talking about cardiac arrest and we are labeling it as sudden, it means it happens all of a sudden. It can happen in a market, it can happen at home, and you would be surrounded by people where there is no medical caregivers. So what becomes eminent is CPR, which is cardiopulmonary resuscitation. In layman term, I can call that as cardiac massage. So that is the only thing, because in medical term we call it as time is muscle. So the least amount of time we take to make sure that the heart gets the blood supply, and that blood supply can be given to the whole body with its oxygen, so that the life can be regained. So that is why learning CPR and everyone knowing CPR is very important, because the less amount of time or minutes we save in giving the CPR, the more amount of chances we give the life back to the patient. So what would be the correct sequence of CPR, or what actually is CPR is? So it is combined what we say as CAB, that is chest compressions. Then we call airway and breathing maintenance. So we compress the chest somewhere around at the chest bone, which is right at the connection of chest to the belly. And we use our both hands interlocked, and we pressure them so that there is at least 1 centimeter of pressure being given over the chest. And with that, every 30 compression should be followed by 2 breathings. So this is how a proper CPR should take place. We should make sure that public learns this, because if our loved ones get, or if any person who's around us gets a cardiac arrest, CPR is the only thing which can immediately save the life of the person by giving them the time to actually get the medical need.
Right, so that is how to do CPR. Now, Dr. Harlalka, heart attacks, heart failures and cardiac arrest, all the same thing?
No, these all three are not the same thing, but all three are interrelated with each and everyone. As discussed in the earlier also, like heart attack and heart failure, these are the main cause for the cardiac arrest. Every heart attack doesn't lead to cardiac arrest. Every heart failure doesn't lead to cardiac arrest. As I told, that heart failure initially presents with anginal pain, sweating, giddiness, other things. So if it is treated earlier, if a patient seeks medical attention, and the standard treatment is to open the artery, either by the these thrombolytic drugs that are available, or by the coronary angiography and the angioplasty. So if we open the artery by any means early, then heart pumping is regained and patient survives. So in these conditions, usually cardiac arrest is not there. So every heart attack doesn't lead to cardiac arrest. And as I mentioned, that heart failure is of 2 types. And heart failure patients, now we are having very advanced medications, very device therapies, artificial heart transplant supports we are having. So heart failure patient also, if they are following the doctor's advice regularly, doing day-to-day activity regularly, taking medications, so they can lead a good quality of life. But sometimes it decompensates, and heart attack deaths, which happens initially in the 1 hour of the heart attack, usually they are led by the ventricular tachycardia and fibrillation. As I mentioned, suddenly heart rate increases and increases to 300, 350, more than 350. At that time, the brain stops working, heart stops, effective pumping is not there, then it leads to cardiac arrest. So heart attack, heart failure, they are not same as the cardiac arrest, but heart attack and heart failure is an important cause for the cardiac arrest.
All right, Dr. Mojaramani, do routine physicals include heart screenings, and if so, how frequently and what tests should be performed?
Heart screening should be included in routine physical, yes. And nowadays, as we see that the age earlier of heart attacks or these heart problems were, labeled as 55, 65, but more commonly we are seeing them in younger age like 35s or 40s. So at least after 40, we should be doing an yearly heart screening in forms of echocardiography, ECG, and TMTs. This is to make sure that your heart is functioning properly and your lifestyle is not ailing your heart in terms, because always prevention is better than cure. The more we look forward our good health, we are not going to get to spend on our bad health. So definitely these checkups are very much necessary. Stress test is something that is going to help us know that whenever we exercise, because nowadays with the increasing competitive life, we are more sedentary. So we must make sure that these tests should be taken at least once after the age of 40. And also we should include screening of diabetes, screening of blood pressure, and screening of cholesterol along with it, because this is how we are going to know that these are not there, or we will pick them early so that we can prevent the heart disease being generated from these diseases. We know that these are the diseases which will cause the problem. So health checkups at least annually after 40 should be the way to go from here on.
All right, on that note, it's time for us to slip into a short break, but we'll return with more questions for the doctors. Welcome back to our special show, Health and Wellness, Save a Life. This is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Let's go across to our doctors. And Dr. Halalka, as per our discussion, cardiopulmonary resuscitation is a life-saving technique. Will CPR always save a life?
See, it's a very tricky question. So we have to see 2-3 factors are there that affect the revival of the patient. First, how promptly CPR has been started. So if patient suffers from cardiac arrest, if any near passerby or if patient's relative start cardiopulmonary resuscitation within seconds or within initial few minutes, then there is reversibility. What happens when cardiac arrest prolongs for few minutes? Then it turns into irreversible states because heart stops pumping, brain doesn't get any blood supply or oxygen supply, and other vital organs they start irreversible damage states. So first and foremost is how promptly CPR has been started. Second, it has been executed properly or not. Proper execution of CPR is very important. CPR is not a medical, sometime a medical therapy. It should be known by each and every layman person because it can happen to anyone at any place. It can happen in mall, it can happen in platform, anywhere it can happen, out of hospital, anywhere it can happen. So its proper execution is very important. So 2-3 points I want to highlight in CPR. So whenever we witness a person who has suffered from cardiac arrest, person should made lie down on a hard surface on its back. Its neck should be extended little bit upwards so that airway will be opened. So if only one rescuer is there, then we have to take care of chest compression. As it highlighted by the Dr. Nikhil that it's CAB, circulation, airway, and breathing. So we are most concerned with the circulation. So to start with CPR, so we have to kneel down on our knees. Then we should start the chest compression. Our dominant heel should be there, and it should compress over our sternum bone, this lower part of the sternum, and the pressure should be enough that it compresses chest by 1 to 1.5 inch, and speed should be around 100 to 100 beats per minute. So only one rescuer is there. So we have to continue the heart pumping by a rate of around 100 to 120. So if this rate heart get enough time to relax also, meanwhile it will give sufficient blood supply to our vital organs. So until unless the rescuer get additional help by any second passerby or any ambulance arrives, they have to continue the cardiac compression. Sometimes it prolongs up to 10 minutes, 15 minutes, 20 minutes. So depends upon the how promptly it is given, how properly it is executed and depends upon the underlying cause of the cardiac arrest. Many of time it is viable, patient revives, but sometimes there is already irreversible damage, or sometimes patient is having some end stage disease, so it is not reliable. But for a layman, cardiac arrest, if CPR is given promptly and in proper way, definitely it's a viable option for the patient and it revives the patient most of the time.
All right, Dr. Moteramani, how important is it for the caregivers, family members to learn CPR, especially those who have a family member who is actually suffering from heart disease?
Very beautiful question, because this is what everyone should be knowing. Dr. Kaushal actually mentioned it very clearly, because this therapy is not a medical therapy. This is a therapy which is basically to be known by every single person, because as I said previously, time is muscle. The earlier the CPR is initiated, there is much more chances that we can save the life. So once we initiate the CPR earlier, so we cannot wait for the medical personnel to arrive at the site where the cardiac arrest has taken place. So if we are having family members, our loved ones who especially have heart diseases, so they are prone for those cardiac arrests. So definitely the caregivers or the family members should know this technique of CPR. And this CPR should not only be taught to caregivers or family members. We should try to make a chain that every single person knows the CPR technique, because when we are talking about learning CPR or giving CPR, the point which we are trying to stress is the less amount of time lapse between initiation of CPR to arrest, the more the chances of the life being revived. So that is why we are trying to educate that the CPR, an effective CPR already mentioned by me as well as Dr. Kaushal, that the effective compressions, so always try to use locked fingers because they are going to give you much more power. Try to compress at the lower end of the chest bone, which we call it as sternum. That is why we call it as meeting point of chest to the belly. And the reason this is important, because this is the only technique that can initiate the blood supply, initiate the flow of oxygen back to the patient or the person who collapsed and went into arrest. That is why learning CPR by caregivers, by family members, as well as most important by every single person of public is very, very, very important.
All right, so it's important for everyone to know the basics of CPR. Dr. Harlalka, if a person suffers from heart disease, what type of exercise should they do?
Yeah, this is a very practical question, because in day-to-day our OPD practice, we as soon as patient get discharged from the hospitals and they come for the follow-up visit, they ask for the routine activity and exercise. See, this should be customized to individual, because there are many type of heart disease. Most commonly, we are having these heart attacks, heart failures, heart rhythm related problems like heart rate becomes low, higher side, heart muscle problem, cardiomyopathies we see. And in India, there are a lot of burden of valvular heart disease and congenital heart disease, because some heart diseases are by birth, some are acquired later in their life. So first is depend upon the disease type, disease severity, how much is the disease severe, and the patient clinical condition. Either patient is compensated or decompensated. That means if patient is stable with the therapy patient is taking, like post bypass, post angioplasty, post valve replacement, how is patient now doing? So initially we start with simple walking, then we start with the brisk walk. Usually heart patient tolerates aerobic exercises well. We generally say that they should avoid isometric exercises, weightlifting exercises, and heavy treadmill exercises, because nowadays we are seeing it almost in every month. Some of celebrities and they are losing life in the gym, or they are doing some workouts. So if someone start workout or willing to do the workout, they should consult their cardiologist. They should get their routine echocardiography, and if indicated, treadmill test to be done, because treadmill test is a test that individualize your physical capability, that how many minutes, how many minutes you can exercise without having chest discomfort, or sometimes chest discomfort is not there, but we are having changes in the ECG. So if someone is planning for heavy treadmill exercise in the gym, because many persons are fond of doing treadmills and all that, if they are having some cardiac problem like diabetes, blood pressure, or any family history of cardiac disease previously, they should consult their cardiologist to get these checkup done. And after that, they should have a customized exercise plan. Otherwise, after stabilization of any cardiac disease, like after cardiac surgery, we give them a customized plan according to the patient clinical condition. That initial days, they can have some 10-15 minutes of walking. After that, they can have some aerobic activities and some yogas, because some of the yogas are not beneficial in decompensated heart failure because cardiac venous resistance. So blindly, cardiac patients should not indulge in yoga also, and in cardiac exercises, heavy exercise or gym exercise. They should consult their treating doctor to give them right exercises, prescribe them right exercises.
All right. And finally, Dr. Moteramani, how does heart disease affect women differently from men?
Men and women, both of them, when they suffer from heart diseases, there are much more differences when we compare either the presenting complaints or when we complain their habitat, or because what we see that women usually have atypical symptoms. When we call it atypical symptoms, we know that symptoms of heart attacks, usually what happens is chest pain, is shortness of breath, breathing difficulties, and the pain usually we feel is in chest. But in women's or in elderlies also, what we try to see is they respond much less with chest pain. They will present sometimes with symptoms like, symptoms of belly pain, which are like symptoms of gas, symptoms of shoulder pain, symptoms of jaw pain. So these kind of symptoms which are atypical, not per se in the chest, are something which are much more common in women as well as much more common in elderlies. So that is the reason where it becomes very much important for these symptoms to be taken into account, because once these symptoms are taken into account, we will be actually focused of getting them treated. Because what happens is we see that women usually tend to consider these symptoms very milder. They say, oh, okay, it's a gas problem. And to some extent, if we go into interiors, the health of women are already being neglected. So that is why these are the two proportions where actually things go haywire.
Right.
Also, women have the slighter hormonal influence of estrogen as well as progesterone. So these are the basic differences when it comes to a woman.
All right. Well, thank you so much, doctors, for answering all our questions and creating awareness surrounding this issue. Thank you all for watching at home. Goodbye.